All right, this week's Exercise Science Lab move of the week is the pull-up hang. We're going to continue to talk about this because and it's a nice teaching tool for going through all the moves and all the body parts we're talking about. I'm just fascinated with Dr. Kirsch's hanging program, but Skyla is also going to be doing a senior thesis project on this, which would be perfect. So we're just talking about doing a pull-up hang protocol for shoulder health, all right? But let's start breaking down body part that we've been talking about: the shoulder girdle, the scapulothoracic joint that moves primarily into frontal plane, the shoulder joint, the glenohumeral joint that moves in the sagittal plane, right? It moves into frontal plane with abduction, adduction. And then Addison had a great question today. She asked about horizontal abduction and adduction. So think about the glenohumeral joint. If you are abducted to 90 degrees, now you're going to horizontally adduct, right? So that's horizontal abduction. Adduction, adduction. The axis is going to go straight down through my shoulder this way, so it's a transverse plane move. Okay, so we think about internal and external rotation of the shoulder being in the transverse plane, but that horizontal adduction and abduction as well. All right, so this week's lab, if you're breaking down a jam analysis, joint actions and muscles, doing a bench press, you got to kind of decide what does your bench press form look like. So we haven't talked about specific form of the bench press, but think about doing, if I'm kind of in a wide grip here and my shoulders are abducted, I'm going to press from that position. That's going to be horizontal adduction in the transverse plane. If I'm doing kind of a close grip with my elbows at my side and I'm pushing from there, I'm going to be flexing my shoulders as I go up. In the sagittal plane, we're probably going to do kind of a mix of both. And even at this, if I'm kind of in this good position here, I'm going to press from there and back, which is going to be sort of that diagonal adduction we talked about. That D1, D2 kind of rubber band rotator cuff moves we talked about in the rehab setting. Okay? But just note that. Pick which one you're going to do. Shoulder joint, horizontal adduction, flexion, and then the correlating plane. That's on page 2 of your jam analysis. All right, but let's get back to the pull-up hang. Let's break down shoulder joints first, or joint actions first. If I'm in this position, okay, remember we're always associating with, or we're always working from anatomical position. So here's my anatomical position. I flex first, and then what do I need to do? I pronate. You're pronating at your forearm, your radial ulnar joint. That's what we talked about this week in lab, is your elbow, right? So your radial, your ulnar humeral joint is your hinge joint, okay? But come up here. Pronate or supinate. Remember, you supinate, you can hold a can of soup. If you pronate, you're prone to dump that soup out. So you're supinating here. That's at the radial ulnar joint. That's a small pivot joint. So unlike the hinge joint, all right, where the ulna is meeting with the humerus, the radial ulnar joint is a pivot joint. Okay, so we have to pronate our radial ulnar joint from anatomical position and then flex our glenohumeral joint. Then we can grab the bar. This is a pull-up position, okay? Now, why do we do this, or why is it recommended, especially by Dr. Kirsch, versus doing a chin-up, okay? Now, if you talk to Mark Riptoe or some strength training guys, they'll recommend chin-ups because you're just gonna engage more muscle. You're stronger in this position because your biceps are stronger in this position, among other muscles. We talked about the bicep brachii, the brachialis, and the brachioradialis, right? The primary elbow flexors. But in this position, we're doing a pull-up position because we're going to pronate first. And remember, one of the compensations of a pronation is internal rotation. If I want to pronate to this position, but I can only pronate so far, I might begin to internally rotate here, okay? So we're kind of looking at pronating our forearms, internally rotating our shoulder joint a little bit, and then going into this position, all right? So we can reach it shoulder width, and there's a difference as we're trying this in lab. You can go shoulder width, you can go wider than shoulder width, but if you're really looking to affect change within our subacromial area, we'll talk about that in a second, we can go with the closer grip, all right? So I'm gonna hang in this position. Now the program is 10 to 15 minutes of hanging, just as much as you can. 30 seconds on, 1 minute off, 30 seconds on, 1 minute off. For 10 to 15 minutes, okay? We're gonna do something similar to Skyla's program, all right? So we get the joint actions down. The shoulder girdle is going to what? Elevate a little bit, and just for my humerus to come up to this angle, as my humerus comes up like this, my scapula has to begin to move with it. It needs to upward rotate. It's going to elevate a little bit, okay? We can watch for a little pronation maybe as we go forward, but for the most part, we're talking about upward rotation and elevation, all right? So the shoulder joint, we talked about that, shoulder girdle, and then the elbow joint, 3 primary joints and what they're doing, okay? Now, where are we affecting change? We call it the Coracorder Chromium arch, all right? Which is made up of 2 structures, basically. The Chromium process, and then, I thought I had a shoulder blade with me. I do. The Chromium process, the Coracorder Chromium arch. So there's your posterior scapula there, your anterior scapula. This is your coracord, right? This is your Chromium process. By hanging, we're trying to pull that humerus up. I'll grab the humerus, sorry. Should have totally been ready for video. So as you go up in this position, you're going to elevate, you're going to upward rotate, and then you're going to go up into this full flexion, okay? And that's where you're sitting on that acromion. So the shoulder joint is kind of sitting on this. So the Dr. Kirsch talks about this joint between the humerus and the acromion, and you're trying to affect change on the actual acromion process. Remember Wolff's Law, where we can actually change bony structures if we stress them enough. And then there's the ligament between the acromion and the coracord, all right? CAL, coracoid acromion ligament. So we're trying to affect change in the acromion process and then the ligament between the coracoid and the acromion. If we can affect change in that arch, open up a little more space, we're essentially decompressing this space through this traction and through this movement while the humerus is sort of impinging or pressing up against the acromion, all right? That's the idea of the Kirsch program. That's why if we're going to try to cause traction there or work underneath the acromion, subacromion, the surgery for it and what you might be doing PT for one day is a post-surgical physical therapy for a subacromion decompression surgery, okay? But that's the question, right? Do we go in there and mess with those structures? What are those structures? Underneath the acromion, you might have a bursa. That bursa gets inflamed, bursitis, inflammation of the bursa. All right, we understand what a bursa is and what itis is, inflammation of. You may hear osis, which is kind of pathology of, because we don't always know if it's inflammation or not. And then what's the primary rotator cuff tendon? It's the supraspinatus. That supraspinatus sits on top of that scapula and shoots right underneath that acromion process. So as we flex and as we internally rotate, that puts that supraspinatus tendon right underneath that acromion process. Okay, so we've talked about this a lot, but we want to get all these structures down. So the joints, the joint actions, we're not really talking about the muscles involved right now, except the fact that these structures underneath involve the rotator cuff tendons and muscles, okay? The biceps tendon is the other one that I mentioned in class today. I'm not sure if I did on Monday, but that bicep tendon that runs down the front of my humerus, if that gets inflamed and then I go into this overhead position, that's another thing that can get impinged underneath the acromion process, all right? So describe the joint actions, the joint positions of the girdle, the joint, and the elbow joint. What structures are we hoping to modify? We just explained that. What is one coaching cue you can use to engage someone's anterior core? So moving away from the shoulder girdle, and shoulder joint a little bit, if I'm in this hanging position, what we talk about? What happens a lot of times is we just go into this stretch. Sometimes we go into an anterior tilt. If we just pull up a little bit, you can see enough of my waist there that if I tuck my tail, if I posterior tilt, remember posterior tilt, my pelvis is dropping back. If I anterior tilt, I'm going kind of forward with my tilt, kind of sticking my booty out, all right? So I'm either gonna pull my pubic bone up, pull into a posterior tilt, or tuck my tail. Whatever coaching cue that you are comfortable with, how you're working with your clients and patients, you'll get to that. But as I do that, and I think it works best to think about pulling my anterior pelvis up, that's going to engage in my core. And in doing so, or my anterior core rather, my exterior obliques and my rectus abdominis. In that position, the other question in the lab to fill out is, in this position, if I'm manipulating or moving my pelvis or my legs, I'm doing some sort of hike, my origin is the rib cage, the xiphoid process of my ribs. My insertion then becomes my pelvis, my pubic bone for my rectus abdominis. Remember, among other muscles, the origin insertion can technically change. So if we're talking about these and kind of understanding where these origin insertions are, for the rectus abdominis, because the rib cage is more proximal superior, and it doesn't really move during the movement. Whereas the pelvis does move, so that becomes the insertion. Question number 4, what might you do to help strengthen the lower and mid traps? So remember, the mid traps, my upper traps are going to shrug my shoulders, therefore my lower traps are going to reverse shrug. So what I can do is, in this position, I can pull my shoulders away from my ears, right? And by doing so, I'm engaging my mid traps. Now, I might also be engaging my lats and my teres major, because I can also pull my humerus down and away from my ears. So I will engage some shoulder joint muscles. But if I really stay in this hang and flex, and I'm focusing on my shoulder girdle, what I'm trying to do is just move in the frontal plane. Take the shrug out of my shoulders and then relax. Take the shrug out of my shoulders, pull my ears away from my shoulders away from my ears away from my shoulders, and I'm going to engage those lower and mid traps. It's not a bad exercise. And it's also sort of the beginning, one of the beginning stabilizing forces in exercise you do. So if I'm going to do a pull-up, one of the first things I'm going to do is do that little reverse shrug and then go into my pull-up. All right, so those are questions there. And I think we kind of covered everything. I might do question 5 and 6 in a second too, but that's your pull-up hang. Those are the structures we're covering. Fill that out with your lab report. This video should give you all the answers there, but I want you to articulate that, put that down in your answer, so you can get used to not only doing a video with my button, not only used to seeing a video explaining these things, but putting these things down on paper. The lab reports just help you articulate some of these ideas as well. So, all right, knock that out, and I'll see you next time.